All right, many thanks, Ibrahim Bello Gunda, for that background report. And to begin our conversation on the National Cancer Control Plan, let me begin by introducing Professor Usman Malami Aliyu, who is the DG CEO of the National Institute for Cancer Research and Treatment. Thank you again for joining us.
Good morning. Thank you for having me this morning.
Let me also introduce Margaret Mendy Sawyer, who is Head Strategy Development and Partnership at the same National Institute for Cancer Research and Treatment. Welcome to Good Morning Nigeria.
Good morning, and thank you for having me.
All right, Yere.
All right, expecting a little guest to join us, of course. Would introduce him as soon as the connection is established. I'd like to begin right here in the studio, and of course, we'd like to begin with the DG and CEO of National Institute for Cancer Research and Treatment. It's been a busy time for you. I mean, I know how busy it's been, you know, with all of this. But speak to us about this cancer control plan. What exactly is it all about?
All right. So the National Cancer Control Plan is generally a policy document that is set aside by the governments of the nation, you know, to actually curtail the menace of cancer generally in the country. It is not only Nigeria, but virtually every other country that is very keen to combating the menace of cancer is actually has some form of that document. This is the fourth document we are having, you know, generally in the country. Recently, we had that of 2018 to 2022, aside from the first one that we did in 2011, 2018 to 2022. Then we have that of 2023 to 2030, the initial one that we set aside. But because of some review that we did with the international partners, what we call the impact review, that was conducted by the International Atomic Energy Agency, International Association for Research into Cancer, then and WHO. So we conducted a kind of an assessment to know the strength and weaknesses of the Nigerian government in terms of combating cancer in the country. So we found some loopholes, some requirement for some adjustment, and that was why, under the directives of the Honorable Minister of Health, we sat together and then drafted the 2026 and 2030 National Cancer Control Plan, which will serve as a guide for coordinated action that we're going to start unveiling to reduce the menace and scourge of cancer in the country.
So what's the content of this plan, basically?
So actually the content of the plan is actually based on 7 pillars that we have, and those 7 pillars are: 1, early detection and prevention. Then we have early diagnosis and treatment. We also have survivorship, you know, entangled into. We have coordinated advocacy, you know, strengthening of coordinated advocacy for cancer. Then we have like integration of survivorship, which was not captured, you know, in the previous document. We have coordinated research, you know, and personalized, or what we call the precision medicine, which is also an addition that wasn't captured in the other plan. Then we have an integration of the AI, which, you know, in the diagnosis and the treatment of cancer. All these were new additions that were hitherto not captured in the previous plan, so that we can have a comprehensive document that aligns with the world, you know, order generally. So that is mainly the backbone or the pillars that we have in that National Cancer Control Plan.
Thank you very much, DG. Let me get to Margaret. And I'm wondering how global best practices may have informed Nigeria's cancer plan. How do they tie up
Okay, so as we know, that cancer is actually a public health concern globally, and majorly in low and middle income countries, it's highly catastrophic. So looking at what is obtainable globally, what the cancer control, like the DG mentioned earlier, there was an assessment that was done in the nation to assess where we are in terms of cancer control and what are the gaps and challenges. So incorporating what is obtainable in the in the Western world, especially when it comes to guidelines, when it comes to early detection, low and middle income country accounts for, especially Africa, accounts for a high cancer mortality, again, because of late diagnosis. But in the Western world, most of these cancers are caught early, so treatment is actually better in terms of treatment outcome. Treatment outcome is better because those cancers are caught quite early as compared to low and middle income countries. So these are some of the elements that the National Cancer Control Plan is incorporating, especially under the early detection, timely diagnosis, because those are key elements that can reduce cancer mortality and also morbidity.
So what strategies have been implemented to promote early detection?
Okay, so currently we have two major campaigns, which is the National Initiative for Cancer Early Detection, Screening, Connected Access to Care nationwide. It's called the NICECAN campaign. So as part of this campaign, what we do is to integrate vaccination into school health programs. We want to create awareness right from the early stage so that people are aware of early signs of cancers. Children are vaccinated. NICRATs, under the Renewed Hope Health Agenda, have vaccinated 900 schoolgirls between 9 to 14 years for the human papilloma virus, which prevents cervical cancer. There's also the hepatitis V vaccination, which is currently ongoing. As also part of the early detection drive, we have the Shade the Sun campaign, which is targeted for people living with albinism. It's actually to promote awareness on skin cancer. So screening and identifiable symptoms that can predispose individuals to skin cancer. I know you'll be wondering why people with albinism. Studies have shown that people with albinism are actually at high risk of having skin cancer. So that's why this campaign is targeted towards them. It's currently ongoing in 3 states, Lagos, Kano, and Abuja. Kano and Lagos is ongoing. Abuja is going to start between February 18th to 19th. So
when will other states be a part of it?
Okay, so because we are taking it in phases, right, so the next part will be within the next quarter. So we intend to take it in phases and spread it across the different time. As part of the preventive action, so we have launched 8 preventive oncology clinics in 6 geopolitical zones. That's 8 centers. There are 8 of them, but they are distributed into the 6 geopolitical zones. The whole idea of the preventive oncology clinic is for people to have access to preventive elements at an affordable rate, because we know that financing is also a major factor that people look at, and that's why they don't present early for screening. Some of those centers, the screening costs are less than 60% to what is obtainable outside.
All right. Thank you, Margaret. Now, I'm told that we have been joined via Zoom from Abeokuta by Dr. Bolaji Lateef Salako, who is a consultant radiation and clinical oncologist at the FMC in Abeokuta. We thank you very much for joining us. I can't hear you. Dr. Salako, if you can hear me, please unmute so that we can hear you. All right. We'll continue here in the studio until we can get that sorted out. Now, let me get to Prof again. What's different? What's the major point of divergence, or if there is a point of, upgrade from previous plans to this one that we are now operating?
Okay, so thank you very, very much for that. Now, as I've mentioned, the current plan captured advocacy, treatment, and survivorship.
Okay.
Also, palliative care was captured. Effective data registration from cancer, and then integration of AI into cancer diagnosis and treatment. So virtually these are the key things that are trending, and they are assisting mainly the Western world, to combat cancer. Those were missing in the earlier documents that we have. And now, as it is integrated, it will help the country to actually tap from the experience of the other Western countries into the country. And it will also expand and give a room for collaboration. Mainly, currently, at the National Institute for Cancer Research and Treatment, we are standardizing the way we collect cancer data.
Okay.
We embark on strengthening the cancer registries that we have in the country. As she has mentioned, we equipped virtually there are about 8 cancer registries that are distributed within the 6 geopolitical zones with the hardware and software required for effective and standardized data collection. We train personnel that are responsible, for that, on the current terms and methodologies, that are used in this data collection. The aim of that is actually to have a quality data that can represent the actual incidence, the prevalence, morbidity, and mortality rate of cancer in the country. And with that, by following those guidelines that we have introduced, providing the required infrastructure, we can actually have a data that we can rely on. And through that, the Western world can see that the country is currently serious. And I think I would love to say, because of that we are doing, the Institute has gotten a grant from the Bloomberg philanthropist, what we call the Vital Strategy, to further strengthen and collaborate with them regarding this data collection. So we are collaborating with those partners currently in the country to expand human resource development in data science.
Beyond data collection, DG, I want you to speak about how this plan would ensure that the population, or if you like, high-risk population in underserved regions are prioritized.
Can you come again, please?
Now, you talked about data collection. So, yes, we know that in urban areas, a lot is being done in terms of, you talked about early detection, we talked about sensitization. But of course, we have underserved regions. We have people in the hinterlands who do not have access to some of this. So what are you doing in this plan that would, bring them on board and ensure that they get adequate care?
All right. So, generally, because it's a very good question. Generally, if you have a look of a population in the low and middle income countries and in a country like Nigeria, you will see that the people living in the rural and suburb constitute there about more than 70% of the population. So virtually and the equipments that we have currently are mainly centered around the cities. So it is with this proviso that the National Institute for Cancer Care, for Cancer Treatment, Research and Treatment, under the Federal Ministry of Health, now brought this screening program that was mentioned by Andy, that is the NICE scan program. This NICE scan has 2 national pronged approach. One is hospital-based, screening programs. And through this hospital screening program, we target mainly the health centers that she has mentioned, and establish screening centers, for the 5 most common cancers that anybody can just walk into the hospital and get themselves. This has never happened, before the coming of this government. It is an initiative of His Excellency Ahmed Bola Tinubu, through the Renewed Hope agenda. So now for those that are living within the rural areas, so what we are currently doing is reaching out to this rural community through okay, let me set an example, the one we've just finished conducting within Abuja, what we call the APT project. The APT project was conducted by the National Institute for Cancer Research in collaboration with American AACR, what we call the American Association for Cancer Research. We went into the community to actually give a health talks, generally health awareness and health information regarding what are the risk factors, generally in cancer, through the gatekeepers. And these gatekeepers are mainly the rural, the traditional rulers within the country. So through them, we were able to reach out to PHCs, the primary health cares that are within this community, to one, upgrade the knowledge of the healthcare givers within that are manning the primary healthcare services. And through that, we were also able to link the preventive oncology or the health education in cancer with other programs that are currently running within the PH. Like, integrating this with those that come for routine ANC, to tell them the importance of, getting themselves screened, allowing their girl child to have HPV vaccine, and giving their children the hepatitis B vaccine. That we just completed with this region, and currently we are expanding it so gradually. So you can see what we are doing. And then to improve on that, we are currently working with other partners, because currently we have launched what we call a mobile screening van, mobile screening clinic. One has been in collaboration with some NGOs internationally. We have one that was actually currently donated to University to Ibadan under the program that is run by the University College Hospital. It's a comprehensive van that has virtually all the complement to conduct a testing, DNA testing, and some screening services for the 5 most common cancers in the country. We were in Abuja just 2 weeks back, and we drove the band there into the community. We've screened more than 5,000, women, children, and thereabout that presented themselves for some cancers. Some that were found to have early cases of cancer were treated outrightly, and that is the beauty of, detecting them early, free of charge.
All right. Yeah. Thank you, Prof. Let me get back to Margaret. Is there a role for international partners in terms of delivery in all of this? And while at it, are we borrowing any leaf at all from them?
Okay, thank you. Yes, the international partners play a huge role in supporting the cancer treatment. Like I said, in improving the continuum of cancer care, is actually a collaborative effort, not just for the Nigerian government. Like we mentioned earlier, that we currently work with the International Atomic Energy, WHO, and IAC to do an impact assessment. The whole idea of having that impact assessment is also to look at the equipment in Nigeria. They also are par with other countries in terms of guidelines. Are we there? Yes. So all these collaborative efforts are important when it comes to cancer control. Now we go to research. Cancer research is something that we also need to put, because we need data. without data, we can't make some informed decisions that will be beneficial to the patient. So integrating some of these elements with partners are very key. And when it comes to financing of cancer care, we know that cancer care is considered catastrophic, even to the high-income earners. You know, so we also need partnerships around there to ensure that the cancer treatment is also subsidized for the country.
All right, many thanks, Madam Sawyer. I would like our viewers to know they can be part of this conversation by sending us SMS or WhatsApp message. The number is on the screen. We'll look forward to reading your messages, and of course our guest would respond to them. I'll get back to the DG now. Of course, while we try to re-establish connection with Dr. Bolaji Lateef Salako, who would be joining us for the conversation from Abeokuta. Prof, you know, you talked about data, you talked about what you're doing in terms of screening. What are you doing in terms of research?
All right. So, you know, I think it's a very important question. Research is one of our pillar, a basic component of why the National Institute for Cancer Research and Treatment was actually established. Now, we are currently doing a program that we call SINCA project. The SINCA project is actually an innovation of the institute, you know, under the Federal Ministry of Health and under the umbrella of Renewed Hope Agenda, you know, generally aim at strengthening the research capacity of our early career scientists that are located within the country. So what we do, you know, in that project was to actually locate those younger researchers that are located within the 6 geopolitical zones. So we selected, there are about 6 centers, you know, within the university and teaching hospitals. So we selected those young career scientists, we trained them, you know, on how to conduct a basic research techniques, you know, in the area of genomics, or what we call generally in the area of omics. When I say omics, you know, the scientist actually knows what entails the component of how to conduct the basic research and also clinical trial. Then I think it took like almost there about 4 weeks to 6 weeks stretch treatment, you know, and that involved taking those young researchers into accredited center research lab that we have located, you know, within the country. One is Camret, I know, in Sokoto, that is the Center for Advanced Medical Research in Sokoto. That we use one in Kano, one in Ibadan, and even the Covenant University, you know, in Abeokuta. So these scientists were trained on how to conduct this very important research, and from there, during their training, they were able to come up with some key critical topics, you know, that they want to conduct research on. And the institute gave a grant to virtually each of these, those that were selected, the best researchers, more than 10 researchers, and they are currently ongoing based on the research that we have given. Those that develop interests that are keen, you know, to excel in the area of research, mainly the clinical trials, in the production of new modalities of cancer care, we gave them a scholarship to go for like a master's degree program that will help them to excel. So that is currently ongoing in Nigeria.
Away from training, DG, I mean, NICAT was established in 2017, you know, thereabouts.
2023.
2023? 2023? Okay, well, correct me. Okay, 2023. I mean, this 2026. Any groundbreaking research at the moment, maybe on the way, or, you know, close to a conclusion that you think that Nigerians should begin to expect from the Institute?
All right. So there are some researches that we are currently doing a partnership research that we are collaborating with other agencies, you know, because of just what you have had. The Institute is just like 2-3 years, you know, they are about of age. So we are actually embarking on those, you know, centers that already have an established lab that we can work and collaborate with. So to mention, we have a Syndicate Bio, which is a private-owned company that is well known in the area of genomics, and we are currently embarking on a research, what we call the National Cancer Genome Research, and that is the first of its kind in the country. What we are trying to do currently is to identify the genes that are responsible for the 5 common cancers in Nigeria. That has never been done. The importance of that is when you do that, you'll be able to see the changes within the cells, the cancerous cells of virtually these patients that are having these common cancers, and know what are the key changes that occur that made them to have the disease. What are the drivers of cancers within, these individuals that we have. Now, if we know that, we could be able to design a treatment that is purely tailored to those anomalies that are detected within the patient. Most of the drugs that we are having currently in the country were based on the researches that were done purely on white Caucasians, outside the country. We've been mentioning that only there about 2% or less of the black or African subpopulation are represented or used in the clinical trials of the drugs. Meanwhile, these drugs, after they, tried them in their cohort, in their subpopulation, whatever responses they found to be effective, they will just record it and then globally generalize it and then push it down on us. Whereas most of the drugs that have, of course, the drugs will work in some part of the population, but it can at the same time give a lot of side effect reaction and even lead to death in some of the African subpopulation because they were not part of the yes. So that is what we are doing. By the time we finish, we'll be able to find the signatures, within these genomes that actually drive our own cancers and design a tailored treatment. So it's that is just one aspect of it.
Thank you. Okay. Now, let me get back to Margaret. Are we now able to close the gap between urban and rural cancer care with this plan?
Yes, so with the plan, we are able to address the gaps, Because number one of the key challenge is actually when it comes to navigation. We have people in the rural areas, but how are we able to navigate them to the treatment center? The DG mentioned mobility when it comes to mobile clinics. So these are one area. This is a particular area that we have identified that can help close the gaps between the referral pathway. Another thing is on telemedicine. Because of the patient-to-doctor ratio in Nigeria, we understand that in some rural areas, they may not have access to oncologists or surgical oncology urologists, again, because of the number of doctors to patient ratio. So what NICRAT has done under the Federal Ministry of Health is to provide telemedicine equipment in 8 of these prioritized states, all to address those referral pathways. So if we have a doctor in Abuja, for example, and we have patients in Nasarawa, right? For example, in rural areas of Nasarawa, they are not able to come to Abuja. We have those telemedicine suits that we've donated to some of these hospitals to aid communication between the primary healthcare workers and the specialists in the teaching hospital. All of these are geared towards addressing those referral gaps. There's also a program that is currently ongoing with Roche. It's called the Brands Campaign, and it's a patient navigation program as well with Oncopadi. The whole idea is to ensure that patients, no matter where they are in the country, they have access to specialist care. So it's now for awareness, to create more awareness around that, so that those primary healthcare workers, trainings are being done. Recently, we just conducted training of frontline health workers in the rural areas, community health workers, the CHOOS, nurses, just so that they can understand and identify cancers. What are the signs and symptoms to look out for, and where do you send these patients to? Because it's not just about identification, but what's the next step? What are the next steps to take in actually navigating the patients to the nearest point?
How do we normalize screening? Because there lies the difference between early presentation and late presentation, which accounts for a large number of mortality.
Yeah. So one of them is about guidelines. Recently, there was a national task force for cervical cancer elimination. We established a cervical cancer screening guideline. This was done in collaboration with other stakeholders under the Federal Ministry of Health and Social Welfare and NICRAT. We established that screening guideline, and the guideline is also out for the public. The guideline is to help the frontline workers. When it comes to family physician and other frontline health workers, understand what they need to do to aid screening. Because again, like you said, early detection is key. So guidelines awareness, we have the breast pathology report template, which is also to guide and understand that, okay, once screenings are done and you have samples, how do you store those samples and ensure that they are gotten in the right condition to the pathologist? There's currently an immunohistochemistry training ongoing for pathologists so that they can also know how to collect samples for detection of cancers. So these are some key areas. The preventive oncology clinic, again, that we've mentioned, we've provided them with equipment, both infrastructure, computers, hardwares, testing kits, all of this to aid early detection. So once these are done, of course, we will not get there in one day. It's still a gradual thing. NICRAT was created in 2023. This is 3 years.
But the Act is 2017, right?
Yes, the Act was in 2017. Yes,
okay, thank you. Thank you, Madam Mendes Sawyer. You talked about, this screening so much, early detection, fantastic. But let's talk about the cost of care itself, which is on the high side. Anything in this plan to, reduce the burden on Nigerians?
Yeah, okay, so thank you very much for the question. As you know, the treatment of cancer, anywhere in the world is actually expensive. It's quite expensive. So it was actually because of that the government of His Excellency Ahmed Bola Tinubu, under the Renewed Hope agenda and under the effective supervision of the minister, coordinating minister for Health and Social Welfare, and the second, that is Dr. Isiaq Salako, that is the State Minister, introduced what we call the Catastrophic Health Fund. This that is under the health insurance scheme. The Catastrophic Health Fund is actually meant to subsidize the cancer treatment for those that are enrolled that already have, health insurance scheme. So the radiotherapy, chemotherapy treatment, and even the other immunohistochemistry tests required to commence treatment are subsidized in most of our cancer centers of excellence. I don't know whether you have had this new introduction, and it's being run by the National Health Insurance Scheme. Now, for those that does not have the NHIS, we have what we call the National Cancer Health Fund. The National Cancer Health Fund is being run by the National Institute for Cancer Research and Treatment, and it is a fund that is set aside, purely funded by the government. It is mainly meant for indigent cancer patients, those that cannot afford the treatment, and most likely those that are not covered under the NHIS. So it is currently being test run in the 6 cancer centers of excellence that we have. It's just a platform that if you present yourself having this disease and you cannot afford, you go to the 6 centers that are distributed within the 6 geopolitical zones. The doctor there can advise you after maybe passing through the requirement. Once you pass, he will ask you to please log go online, log in your details and whatever, and they can approve and you can access your treatment free in the center. But you have to qualify, from the requirement that were set. They have to make sure that you have passed virtually all those required tests that are set aside. So you have to.
How many radiotherapy centers does Nigeria currently need?
All right. So the need from the IAEA requirement is 1 machine per a million population.
Per million?
Per a million population.
So if we are 250 million...
So if we are 250, you can guess we need about 200.
How many do we have?
So currently, generally, we have like 12 machines in Nigeria.
Functional? Because I hear that breakdown and maintenance.
Incessant breakdown, there are a lot of breakdown, in the country. But nonetheless, having 12 is actually quite commendable. Before the comment of this...
For the size of our population?
Okay, so let me talk to you on that. Before the comment of this administration, we had only 4 machines in the whole of the country. And hardly you will find at any time that 2 are working before the comment of this government. Within the first year of the comment of the government of Ahmed Bola Tinubu, he promised 6 machines, and they were all budgeted for. Currently, just about 3 or 4 months ago, the Honorable Coordinating Minister for Health, the Honorable Coordinating Minister of the Economy and Finance, and that of Budget, with also the Minister of Information, launched 3 out of them. So currently we have 3 more centers that are working, and 3 are coming before the end of this month. So in all, and now if you go virtually, we have like more than 7 or 8 working in the country. So from where we were, to where we are now.
We've made a lot of progress.
A giant stride. We are not where we are.
Have we made
now,
progress in terms of manpower? Because there are reports about oncologists not being available, oncology nurses, medical physicists, and all of that.
So actually, it's a challenge because of the incessant JAPA syndrome that has actually inflicted not only in the area of oncology but virtually all the sectors. Of the range of healthcare personnel, from doctors to nurses, radiographers, and whatsoever. But then the country is trying its best. Of recent, just a few months back, the National Postgraduate Medical College has approved and established a faculty for radiation and clinical oncologists, and that is, a boost. For the first time, we have a faculty purely for cancer training. And there is this surgical oncology training that has been also introduced by the West African College. Now, the West African College is holding its annual, conference, 66 or 67 annual conference in Accra. And they too, in principle, they have agreed to establish a faculty for radiation and clinical oncologists in the West African College of... the training for doctors generally is under these 2 colleges, the National Postgraduate Medical College of Nigeria and the West African College of Surgeons. So all these 2 now, for the first time, in the history, has opened a faculty for clinical oncology and some form of surgical oncology, as well as, gynecological oncology. So this is a boost, to the country. So we hope, in the coming years, the shortfall that we are witnessing will actually, be covered.
You just talked about this administration doing so much in terms of, the centers that are now viable and functional. What is being done to ensure that there's sustainable financing for cancer care? Beyond this administration. So it doesn't look like there's a change of government and then things go back to worse.
All right. So based on the years of experience, we've gathered, we realize that establishing centers alone will not suffice, for the country because of the incessant, breakdown of the equipment and so on and so forth. So it was because of that the government is currently collaborating with other agencies like it's working or indulging in PPP programs, to improve sustainability of virtually all the centers. Like if you take, for example, the NSIA loop, it is a government-owned center that the government is now collaborating with NSIA, the National Sovereign Investment Authority. And I think since the establishment of the center, we've never heard of a major breakdown of machine that lasts for more than a week or so. And that is, keeping the machine continuously working and improving access generally in that part. Now, currently, we also have other organization coming in. I know of Onco Clinics that manages Enugu, was the Abakaliki, yes, and Sokoto. This centers is actually they are running a PPP model, and this PPP model is up till now maintaining effectively the services of that machine. So if you compare to where we were before to where we are now, this PPP model has been maintaining these centers generally in the country.
All right, Prof, thank you. Now, Margaret, does this new plan present a more prominent role, for insurance? Because the problem of affordability is still going to be there. We are not going to treat cancer patients free given the population size. So is insurance now able to play a bigger role in all of this?
Yes, so one of the pillars is also on advocacy and financing for cancer care. So the NHI is also an integral part of this National Cancer Control Plan. The DG mentioned the National Cancer Insurance Fund, which the Honorable Minister of Health has worked on. So all of this is to help and support treatment of patients. Currently, some medications are covered under the health insurance scheme. Right, some of them are under partial coverage, which means that the patient pays 50% of it, and some of them are under 90%. Patient pays 10%, and NHI covers 90% of it. But again, for it to be sustainable, you need to ensure that a dedicated fund for cancer care is available, which is why the minister is launching that National Cancer Insurance Fund to support cancer treatment. Because NHI is not just about cancer care; it covers
about general health.
Yes, general health. So it means that because the treatment of one patient for cancer can take up a huge chunk of NHI's budget when it comes to treatment. So that's why this fund was set out for cancer care to support cancer treatment and affordability.
Is it sustainable? Because it's not a question of setting it up.
Yes.
It's probably not being funded, or it's funded briefly. And is it a sustainable funding plan?
Okay. So for it to also be a sustainable funding plan, right, there have been discussion as to how funds can be generated. I know there's a technical working group which, yes, it's working on, there's a technical working group that's actually working on some projects to combat that, like tobacco, smoking of tobacco program, alcohol. Can we increase taxes around that just to support
cancer, since they are causes of cancer?
Exactly, since they are causes of cancer. So some of those fundings from those taxes can also be pushed directly into the insurance fund and to help sustainability.
I think that's a brilliant one, really. Tax those who would likely get cancer, so they eventually, pay for it. But when you talked about subsidizing cost, does that include chemotherapy, radiotherapy, and all of that? And then speak about the challenges you have faced so far. I mean, since the coming of your agency, what's been the main resistance to all the programs and initiatives you've put in place to ensure that we scale up in terms of cancer care?
Well, so generally, challenges can come in actually so many ways. One, I think our major challenge, sometimes is what we call resistance to change, Some people are so much used to what maybe the knowledge of the best or the knowledge of the past they are so much used to doing what they are doing. So now you are introducing new things. Now it's very difficult to actually integrate and find a way to collaborate, with other agencies, to actually assist in supporting the newer agencies that are coming up, together. Currently, she has mentioned about this issue of the syntax. It's something that we have been pushing, hard to not only tax the tobacco company or the alcohol beverages country. We also want to tax, all this, the sugar company and the other beverages that have sugary, high content of sugar in their black beverages, Fanta, and so many other things. But because of how do I put it, political will, is always a problem. So they have their own ways. You will want something good for the country, but there always has to be that resistance because they are always looking at the profit that they are making. If they pay that tax, definitely it will amount to what they are getting, deep in down. So a lot of challenges, part of that is major. And another thing is if you are, what we realize, like if we are campaigning for reducing, improving the health-seeking behavior of virtually the populace, Nigerians in the country, people that are so much used to, like smoking cigarettes, taking alcohol, or working without all this required PPE, most especially those that are working in the Fadama, they will tell you that this is what we inherited from our grandparents. We are so much used to this, and then there is no way that we can. So these are part of the challenges, accepting what you are bringing. And another very good example is myths, regarding taking up HPV vaccine. Okay.
Oh, thank you. I thought you had learned, but it's okay. We'll take some messages before we go
just
on
a minute,
break.
Just a minute. That HPV vaccine for meat, are you discussing with the livestock ministry?
Yes. We actually discussed with the ministry, even with the Ministry of Information regarding you coming in to actually assist. A lot of actual people have this myth regarding taking vaccination. That if we take it, it will make if we allow our children to make it, it will make them infertile, and so on and so forth. I said, okay, look, when they introduce like this COVID-19 vaccine, a lot of people are saying, don't take, if you take it, you will not see your birthday, your next birthday, because of course with that, we took it, and here we are still working. And there are so a good, example of taking vaccines that we have, like the monkeypox that was very much prevalent, in the past. It's virtually, it has been wiped out. It's not, hardly you see anybody with that, all those form of diseases. So it's quite a challenge. And you can see that even the clergies, the pet house people, the traditional rulers sometimes are, supporting those myths. So our call is virtually whatever the country is bringing. The country is actually, the government of the country has the interest of people at the back of our mind. If the people doesn't get well and leave, who are the leaders going to govern? So virtually, we have series of tests that even if these drugs are, the NAFDAC has all the required, gadget instrument in their lab that they allow all these vaccines to pass through and to make sure that they are safe for our people before being introduced into the community.
All right, thank you very much, Prof. I guess we now have to take that break. And so that when we return, we'll perhaps begin with the messages that have come in. Please stay with us. All right, thank you for staying with us. This is Good Morning Nigeria on the network service of the NTA, and of course we are getting into our finishing track, and we have messages that have come in as we discuss Nigeria's National Cancer Control Plan. And first from Muhammad Musa Afamai. It says, given the National Cancer Control Plan's goal to reduce late-stage diagnosis, what culturally relevant strategies can Nigeria implement at the community level to dispel myths and increase the uptake of cervical and breast cancer screening services among rural women? Okay, our guests will take note and respond. Good morning, ladies and gentlemen in the studio. Good morning, Nigerians. To what extent is the National Cancer Control Unit taking awareness campaign to rural areas to educate women and young ladies on the danger and effects of cancer and the risk factors, for reduction? So you said, I hope I get that message. That's from Chris Simeon, but both of them are talking about taking awareness to the community level. And then from Ozebe Jegbefu from Edo State. Good morning, dear discussant. My suggestion is that when you conclude on the cancer control plan, the template should be made compulsory for private and public hospitals to use for easy access to treatment. And for me, finally, from Engineer Wale Additional, cancer is costly to treat. We know that. So the best policy is compulsory tests for common cancer traits. In my case, I didn't know except by chance. I had goat-like poo with blood. I did self-medication until a doctor friend suggested a test which confirmed cancer stage 2. I went through surgery, rehabilitation, 8 months of chemo 3 times weekly, costing over 25 million naira 3 years ago. That's from Engineer Wale Additional. Perhaps before she takes her messages, Prof would like to respond to some of the messages.
All right. So I think we have to let me start by thanking them for the questions. If you had the current National Cancer Control Plan that we have, spelled clearly as the first pillar that we have is engaging in early detection. And through that, if we can see the plans that we are currently setting out, currently the programs and the projects that we are carrying out at the National Institute for Cancer Research and Treatment, that is NICRAT, under the Federal Ministry of Health, is to, one, improve the awareness of those common risk factors that predisposes one to cancer. And this, we've been going out currently through this series of projects we've been carrying out that, I think currently one is ongoing in Kano, and then one in Abuja, the FMC, and then the subsequent one will be in Abuja, just like what she has mentioned. We have APT program is also targeting on cancer screen awareness, and then the screening campaign. I've laid out so many examples. These are things that cannot be done as a one-off, mode. It has to be continuous, and we always like to thank also the media houses, for doing what they are doing, because virtually having us, frequently on this program help to disseminate the importance of having yourself being screened, regularly, and then even knowing the risk factors. We have good plans that are well spelled out that the Nigerians are going to actually see in the few weeks to come, that will continue to educate the populace on the need for early screening and even treatment.
Right, and that same early screening was what Engineer Wale Additional was talking about. 25 million naira at stage 2. How many people can afford that? You want to have a go at some of the contributions as well?
Yes, so like the DJ has mentioned, the media houses play a very critical role in raising awareness about screening and vaccination, because there are lots of myths, especially when it comes to rural area about vaccination. So we need clergymen as well, religious leaders, and to support us in this program. So we try to also integrate them in some of our campaigns, because we need their buy-in to help promote this. We talked about the cost of cancer care. As we mentioned earlier, cancer care is catastrophic in our nation. The cost of care cannot be overemphasized, but early screening is what is important, because once you are able to get these symptoms early enough, your prognosis is better, treatment outcome is better.
You consider stage 2 early? Your
chances of survival is also better. So anyway, stage 2, it all depends, right? For stage 2, it's considered fairly early. It's considered fairly early because it can be stage 3, it can be stage 4, and in some cases metastatic. So if at stage 2 there are no metastases, then there are things that could be done also to improve survival.
All right, let me read some more messages that we have from our viewers. This one says, please, how best and promptly can the Federal and State Ministry of Health address the issue of infrastructure gaps where there is a high dependence on a few often overstretched centers? Long travel distances to centers exacerbated by poor infrastructure affects early diagnosis. God bless Nigeria. That's from Nanda Puya from Jos. Another one says government should train more oncologists to tackle cancer-related issues, especially at the grassroots. That's from Chris Simon. This one says, good morning, everyone. Do they have a screening guideline for cervical cancer? That's Blessing Etim from Calabar. And this one says, hello, NTA. I'm joining live from the United States. My name is Professor Edidiong Mendy. The Nightcrat segment on cancer was very informative, particularly the discussion about establishing cancer research centers across the 6 geopolitical zones. This initiative is important for strengthening prevention, early detection, and treatment efforts. It's especially impactful for underserved and marginalized communities as it helps expand access to affordable and equitable healthcare services. So I'm sure you want to respond to some of this. Of course, I would like to hear Mendy's response, because because of this one we got from the U.S. Fantastic. Good to know that you're watching us all the way from the U.S. Of course. But let Mendy respond. Of course, did you tell us what the states are doing? I mean, if the subnationals are supporting the plan by the federal government, to deal with some of these problems. So let's hear from you, Mendy Sawyer.
Okay. So what is state? Like we said, that is still a long. We still have some things to do when it comes to provision of infrastructure. But again, if we look at where we are coming from, we are already taking the necessary steps in closing that gap. The Federal Ministry of Health and MedSafe, under the leadership of the Honorable Minister of State for Health, have launched some PET CT scanners and radiotherapy equipment in Nigeria. There's also a procurement process ongoing for purchase of PET CT scanners. The DG mentioned the 3 radiotherapy equipment that were launched in the phase 1 of those interventions. There's also a phase 2 interventions that are coming up for the procurement of some of this equipment. NICRAT, under the Renewed Hope agenda, has also launched some diagnostic equipment in some of the states. I know that we may not be at the level of the impact review, which states that we need about 220. But again, this is where we also need PPP to come in, because it may not be very realistic for us to wait for the government, to provide all 220 equipment within a short period of time.
But are you working closely? Are you getting response from the private sector?
Yeah, so like the MedSafe program is one of the private sectors. So we are welcoming other private sectors to also join in establishing this joint partnership to close the gap. So these are some of the things that would be required to, address these gaps.
All right, so DG.
All right. So currently, the federal government, or the Federal Ministry of Health and Social Welfare through NICRAT, is working with the Nigerian Governors Forum to so that at least we can get a buy-in, in taking very strong measures in the sub-national to convert this menace and scourge of cancer in the country. And some states, they have even started, taking it serious by establishing, some cancer centers in the country. Now, we also have what we call FLAG, the First Ladies Against Cancer. Some months back, the National Institute for Cancer Research and Treatment signed an MOU with them. And the importance of that, these are governor's wives that can have access, to their husband, that have unlimited access, to their husband at any time, and they can do the PR that is required for the husband and the government, the subnational government, to give more attention, to cancer care. We are currently working with them, collaborating with them to actually cascade and scale up the cancer awareness and health educations in this country. We have this national task force for cervical cancer elimination in the country, of which the First Lady of Nigeria, Senator Remi Tinubu, has actually, she is chairing virtually that, she is the grand patron, and then she has supported, that task force with a seed grant of about $1 billion, and we are doing virtually good. Currently, we are planning to cascade, a national cervical cancer awareness campaign with screening in the 6 geopolitical zones, and that we are planning to start with Imo. There is a lot of buy-in, and by all those states. So ours at the National Institute, in addition to all this that we are doing, we are also planning to set up offices in the 6 geopolitical regions, in the country, so that at least we can provide the much needed services to closer to, we can bring all those, cancer services closer to those populations, to the people.
How do we track performance and accountability in all of this?
Yeah, very important. So in tracking performance and accountability, it's again looking at the milestones. So if, just like the DG said, before the 2018 to 2022, we had less than 2 effective radiotherapy machines. In fact, at some point in this country, people had to travel to Ghana to get access to radiotherapy care. That has been addressed. So availability is no longer a concern. It's more of access now that we are looking at. So if we want to track, we can say where were we in 2022 and where are we today versus what was done. We look at the total number of vaccination that has been done. So these are some key criteria that we can use to also track our progress. So we have a baseline, we have recommendations. So versus our recommendations, where are we today? So these are all baselines that we have internally that we're using, tracking our progress. We have quarterly reviews just to access and understand where we are. Before I lose my thought, I think someone asked about the screening guideline.
Yes,
it's
for cervical cancer.
Yes. So it's available. You can check on the NICRAT's website, or you check online the Nigerian cervical cancer elimination guideline. So you see it online, you can download it. We have made a couple of engagements about this guideline because we also know that this can help. I just wanted to take that.
All right, as we begin to round up this conversation, we always say prevention is better than cure. DJ, you spoke earlier about vaccination. Basically, but speak about other factors, that could prevent cancer, in whatever form, lifestyle, food, other things that, likely contributory factors.
All right. So very important is, an improvement in our health-seeking behavior, generally, one has to be active, in life. Said, as we all know, that sedentary life is linked with so many diseases, that chronic diseases, of which cancer is one of them. So it's recommended that at least an individual should be exercising for at least 30 minutes, non-passive exercise for 30 minutes, not active one. And that has been compounded to actually give a kind of protection, to cancer. Eating healthy is very important. Cut off junks, reduce taking in red meat. We say reduce, not stop completely. At least some oncologists are advocating there about, let's say, 500 grams of meat per week, if you can take in a lot of vegetables and, fruits. That has also been, found to reduce the scourge of cancer. Cessation of smoking, please cut it off. It has been linked to so many cancers, smoking, right from the cancer of the lip to the tongue to the throat, GIT, to even the anal cancer and then cervical cancer. Alcohol ingestion is also linked to cancer. If you can't, please stay off. If you cannot, they said 1 cup, but that 1 cup should be a small cup. That is the problem, because on the social media, I saw 1 cup when one guy, when he was,
because the cup could be as big
like a small cup, the size of the cup, that he was handling.
So, but it should have been measured in maybe liters, so that you have a sense of it.
At least. So there are so many things that if you are working in virtually all these, asbestos companies, cement companies, and so many others, please wear your PPE. And if you are coming out, if you are light skinned, please always use sunscreen, to on your skin. And if the sun is that very hot, please stay indoor for a while until when, or in your office, So there are so many.
You didn't add prayers.
Well, very important. Very important. You have to be prayerful, You have to be prayerful. And I always like to give this a talk. I was watching Oprah show, and then she invited an oncologist, to the show. And then she asks him, how can one prevent himself from getting cancer? He said, wow, what a tough question. Well, actually, there is no a straightforward answer to that, because as far as I'm concerned, I do not know. But the only thing that I know is that can save you is any food that they give you to eat. Take it to your grandmother. If she identifies it as food, then eat it.
What if you don't have a grandmother?
It's just a kind of how do I?
The closer it is to the farm.
Yes. So if you do not have a grandmother, maybe if you have a grandfather or an elderly person that is, living with you, just ask him, is this food? If he said no, I don't know.
But
stay away from.
But Prof, times are changing. How many people have access, to food straight from the farm? All right, a lot of people have to preserve. A lot of things go on with what we eat, right? So, but speak about how we can still eat these things, right? Even if they're processed, and still be healthy. Does detoxification work?
All right. So, what do you mean by detoxification?
Oh, well, because, there's so many stories flying.
Different into different.
Okay, but
she's asking whether you can eat all these things, down them and eat all these things and detoxify. That's
no, you don't do that. It's quite challenging. What we are saying, you can eat. Just moderate whatever you are going to eat in moderation, but make sure that you are taking your vegetables very well, taking your fruit, exercising your body. The importance of all these fruit that you are seeing, that they increase, the bowel. Yes, whatever you eat, if you are taking fruit, you see that you go to toilet often. And the important thing is that they reduce, the transit time, that whatever you take in will have with your body. Like in the intestine, if you take any toxins and you go to
Pass
toilet,
it out.
pass it out frequently.
It helps.
Helps a lot.
Okay.
All right, let me take this last message before we go, because it's asking, so what is the agency doing in order to make cancer treatment drug available and affordable? Where can these drugs be gotten? That's from Mohammed Sadiq. Perhaps you close with that.
Okay, so we have a program which is called the National Cancer Access Program. Before now, availability of oncology medications was a big challenge in Nigeria. So this program brought together different manufacturers under that platform. We had the likes of Roche, we had the likes of Pfizer, AstraZeneca, Johnson & Johnson, just different multinational and local pharmaceutical companies like Pacemaker on that program. The idea was to make sure that those medications for managing cancer are readily available for patients at an affordable price. So on that program, these medications are cut, the costs are cut by 50%. So the patients have to pay 50%
Okay, all right.
of the cost.
Many thanks. We need to go because of time. Thank you so much, Margaret Mendy Sawyer, Head Strategy Development and Partnership at NICRAT. It was indeed a pleasure to have you on our program. I think the first time the DG sent in a female staff member. Good to know that you have women working in your organization. All right, and of course, DG and CEO, National Institute for Cancer Research and Treatment, Professor Usman Malami Aliyu. It was indeed an honor to have you again on our program. Thank you so much for all that you do.
And thank you for having me.
All right, so that's our package on Good Morning Nigeria this Friday. Thank you so much for watching. Take care of your health. I'm Henry John.
And I'm Victor Azu. Have a great weekend.